Okay, this video is called The 5 Wounds of the Village Idiot, and it's a metaphor relative to the 5 wounds of Christ. So the 5 wounds of Christ, obviously both feet, both hands and both feet, and then in the chest. Okay, this is the painting of Diego Velázquez, Crucifixion of Christ. Here's a painting by James Tissot when the Roman soldier pierced the side of Christ with the spear. That's Longinus, who then came to believe he was the Son of God. Okay, so those are the 5 wounds of Christ. Okay, got to move it to the next slide here. All right, and then as the story goes, that he bled from that wound in the chest by the spear of Longinus, the Roman soldier, and they collected the blood in what became the Holy Grail. And it was thought that the Holy Grail has tremendous healing properties, can heal any injury. And so that's why the King Arthur, and these are the Knights of the Round Table with King Arthur, they wanted to find the Holy Grail, the quest for the Holy Grail. Monty Python made a very funny movie about that, Monty Python and the Quest for the Holy Grail. And it was only Sir Galahad, who was a noble enough knight, that could get it. You know, even though Lancelot was a great knight, he had gotten himself in some dirty business with Guinevere, so only Galahad could find the Holy Grail. All right, but anyways, what has this got to do with the 5 wounds of the village idiot? Well, that's on the next slide here. So let me go to the next slide. Okay, so these are the 5 wounds of the village idiot. Now, just to be fair, my father had open heart surgery too. That was many, many years ago, before I had become more sophisticated in understanding atherosclerosis. And once you go for that treadmill test, you know, McDougall's called it the conveyor belt to the operating room. So they send a person for the treadmill test. They, you know, show some type of problem with the treadmill stress test where they're just walking with EKG leads on. Then they take them for a cardiac cath. Cardiac cath goes in through the right, typically the right groin area. They go into the common femoral artery, the common femoral vein, put a large diameter sheath in both of them, do a cardiac catheterization of the heart. It's also called a coronary angiogram. And they'll squirt contrast in the coronary arteries and take these rapid cine video films to show if there's any narrowing, any blockages in the coronaries. They'll sometimes stent them right there, but a lot of times they'll recommend the patient go to the operating room for a CABG, that's coronary artery bypass graft. And they'll often call it the widowmaker or proximal lesion, like something in the left main coronary artery, for example. And they'll sort of pressure the patient to go. Because I remember at that time, I was just beginning to read, you know, a little bit. I had read Ornish, but I wasn't fully getting it all. I had sort of grown up in the whole stent surgical world. And I tried to talk my dad out of it, but I didn't have enough oomph. And he sort of was pressured by his cardiologist and a surgeon to go to open heart surgery. Anyways, these are the other things that happen during open heart surgery. Again, it's called a CABG, coronary artery bypass graft. They'll go in through the right internal jugular vein here, and they'll place a swan Gans catheter. So I call it a RIJ, right internal jugular swan. And then that'll have an extension going coaxial through the sheath, going out into the main pulmonary artery typically. They will do a rotating circular buzzsaw through the sternum to open up the chest, to crack the chest. And then they can operate on the heart. They'll typically leave, after the end of the procedure, they'll leave a mediastinal drain. That's the soft tissue around the heart. And they'll put a chest tube into the left side of the chest to make sure the lung fully re-expands after it had been down with cardioplegia solution. So those are the 5 wounds. I call it of the village idiot, which is a little bit mean. You know, my dad even had this procedure. But the reason I say that is now you know, if it's just coronary artery disease, chronic coronary artery disease with cardiac angina, you know that you get a much better outcome just by, you know, eating a low-fat, plant-based diet with no oil, the Esselstyn diet, okay? And it's so easy, and there's no negative side effects compared to, you know, this procedure where you could end up with lots and lots of problems. Don't get me wrong. Some patients, I've seen them alive 15 years later, okay? But I'm just saying, if you could fix the problem with the vegan diet, it's rather stupid to go for this giant big procedure. Now, there's some people who need open heart surgery when they have a complex, let's say a valve issue, and there are some special circumstances. But for most patients who undergo a CABG, just because they don't know anything about low-fat vegan diet or they're too lazy to change their diet, which is the vast majority of patients. So these are the 5 wounds of an idiot who's too stupid to learn the low-fat vegan diet with no oil, the Esselstyn diet.